The Ministry of Health maintains that the three-phased vaccination program is on course and that before the end of February, Kenyans should roll up their sleeves to receive the COVID-19 jab. In the event that the vaccine infrastructure is not enough, the government says it will expand and enhance storage space by the end of the 2021 calendar year. This even as 260 more people tested positive for COVID-19, and Dr. Swangira has that update.
For many Kenyans, it's no longer a question of if vaccines will arrive in the country, but when. And as earlier relayed by the Ministry of Health, the first consignment of the vaccines for the first phase is expected before the end of this month.
The country is prepared to undertake vaccination immediately the vaccines arrive in this country in February. So that you are assured that very soon you should be rolling up your sleeve to get your vaccine.
The COVID-19 vaccination program is still in course. It is still divided in three phases, as we had earlier informed you, and nothing has changed.
The program, which targets 16 million people in a period of 18 months from February 2021, will require the capacity of more than 23,000 healthcare workers, including 8,000 volunteers, in areas of vaccine administration, logistics, management, data capture, reporting and monitoring. To ensure that vaccination programs for children in the country are not interrupted by the planned COVID-19 vaccination for an adult population at a large scale, the government plans to expand and enhance storage space by the end of the 2021 calendar year. Besides infrastructure, safety is also a consideration.
In the last 2 weeks, manufacturers of various vaccines have submitted their dossier to the pharmacy board, and we expect that in the coming week we could see, based on how the dossiers will be evaluated, the registration of the vaccine by the pharmacy board for use in Kenya.
Financing is also key.
Made available a budget of 930 million Kenya shillings to facilitate the introduction of the vaccines in this country. Procurement through Gavi is facilitated by UNICEF. And what will happen is that UNICEF is going to support the transportation of these vaccines up to our airport, port of entry.
But the ministry is also sending a caution to the public. Vaccines only serve the purpose of minimizing hospitalization and deaths.
Remember, the vaccine is not a silver bullet. Remember, UK has immunized more than 13 million people, but are still in a total lockdown.
In the last 24 hours, 260 people have tested positive for COVID-19 out of a sample size of 5,873, bringing the total number of cases to 102,613. No deaths have been recorded, with the fatalities remaining at 1,794. 83 patients have recovered from the disease, while 341 patients are currently admitted in various health facilities.
We are not yet out of the woods. Remember, we mentioned that we would see perhaps the effects of December, the effects of school reopenings coming into, this time round of the year. And so this is a situation we are monitoring.
This is not a time to be able to drop the ball. We need to continue to adhere to the measures to ensure that even if you have a subsequent wave, it is a small wave that we can be able to take care of and ensure that our healthcare system is not overwhelmed.
Vaccines and vaccination are two very different things. So many factors influence when a country will get its own consignment, such as global supply and demand. For many Kenyans, it's no longer a question of if vaccines will arrive in the country, but when. The Ministry of Health continues to give assurance that this process in the country is on course. Dr. Swangira, Citizen TV, Nairobi.